we'll have that available for them. Alrighty, and just as introduction, Dental Informatics Working Group, this is our agenda. I'll just give a brief overview of who we are. I'll introduce our speaker, and then if we have any questions after that, we'll have those. Feel free to put those in the chat, and we could save that for you, Winnie, or if you want to do it during, we could do that however you want to do it. And then we'll talk about some upcoming events and then how to get in touch with us if you all are interested in that. So our mission with the Dental Informatics Working Group is to serve as the focus for individuals and organizations with interest or involvement in health informatics, with that special emphasis on dental informatics. And so we're always happy to meet individuals and have individuals come in and talk about their work in the field in which we are seeking to serve our focus with this. So our introduction to the speaker, I'm not going to talk long, is Dr. Winnie Tan. She's a general dentist at AltaMed, and that's a federally qualified health center in Los Angeles, California. She splits her time between clinical care and supporting the dental department as a part of the clinical informatics team. So her work focuses on improving the workflows and keeping her department up to date with Wisdom, Epic's dental record module. So we're so happy to have Dr. Tan today, and feel free to give us more of an introduction and however you would like to come. Thank you so much.
Thank you for that introduction, Carmen, and thank you for having me. I'm going to go ahead and start sharing my screen. Balancing clinical care and informatics. I really wanted to talk about this after realizing that I'm one of, I think, just a handful of folks who are still a practicing dentist. A little bit more about myself. I graduated last century, 1999, from the University of Southern California School of Dentistry. I was lucky enough to, I feel like I was recruited as a senior dental student by one of my professors into a job at the school, and it was specifically the mobile dental unit. Not too many people are familiar with that section of USC, but essentially we were a small group of dentists who drove to the more rural areas of California. And if you're familiar with California, anywhere from Calexico and Blythe down south to Redding, California up north, and everywhere in between, I feel like we spent a lot of our time in Bakersfield because our target population that we served were the children of migrant workers. So it was very specific. And we did that for about a week and a half of every month. We would drive out to these places. There were a group of senior and junior dental students who had chosen this as their elective, and they would travel with us. We would set up shop on a Thursday, and they would create a mobile dental clinic at the location that we were in, which included 2 trailers that were equipped with 4 dental chairs, 1 RV that had 3 dental chairs, and in the school gym or the cafeteria or wherever they had enough room, we would set up about 30 or 40 cardboard chairs when we started that would be used the very next day by the volunteers who came out to help us. So we saw 120 kids is what we averaged on a Friday. The dental students did the exams, they took the x-rays, and once they did all of that for all the kids, they would gather in one area to do their treatment planning, and all of the professors would double check, answer questions, etc., so that we would have them, their paper charts with their x-rays taken the old-fashioned way, and make sure that they were ready for all the volunteers who were going to be showing up on Saturday, which was our big day to get through all 120 kids, just to get a jump start on their treatment. So it was a big operation. So we would see them on Saturday, and then Monday through Friday, we would actually complete all the necessary treatment with another group of kids who would rotate in and complete the work. So I did that for about a week and a half of every month, and the rest of the time I spent working at CHLA, Children's Hospital in Los Angeles. When I tell folks this, they usually ask, well, you know, I must have had a very understanding boss that would allow me to leave any random week and a half to go do this job and then have a schedule for me in a hospital setting. I was lucky enough that my boss was the same man. He happened to be head of the mobile clinic at USC, and at the time he was the director of the dental department at CHLA. So I really lucked out there because, again, didn't know at the time, but I split my time between those two locations. But at CHLA, I was one of maybe two general dentists, and the rest of the folks there were pediatric dentists or residents who were studying to be pediatric dentists. So we only saw special needs kids. I had one day of IV sedation cases, I had one day in general anesthesia, and 3 days of just open bay clinic where I would get the older kids, and by older kids, from their standards, it was anyone who had a permanent molar. So 6 and up were the patients that I saw. So I did that for about 4 years until I felt like I had enough experience, and it was a great learning experience, but the traveling did get to me. So what do you do after, you know, that kind of experience? You open up your private practice. So that's what I did in 2003. I ended up opening up a private practice in Boyle Heights. And if any of you are, again, familiar with California or Los Angeles, Boyle Heights is not necessarily known to be a prime location to set up a private practice where you want to do all the dentistry that you were taught from school. So, you know, veneer cases, aesthetic cases, implants. But it turned out that I found this nice little nook, this office, whose 95% of their patients at the time were union workers, they were teachers, they worked for the city, they worked for the state. So it was primarily insurance, which worked for me. I wasn't a Medi-Cal provider at the time. I was trying to apply, but I actually didn't have a large population of Medi-Cal patients. So I got to practice. And in the 12, 13 years that I was there, I got to build the practice that I wanted to do. When I purchased that practice, they were using just an old-fashioned appointment book and a pencil. And that's how they made their appointments. They were paper charts. So that was my first taste at implementing some kind of computer system. It was my first experience with a conversion. I worked with an analyst to figure out the best formula of what my schedule should look like so that I could be a viable business and sustainable. And so you learn a lot when you're by yourself and in private practice, and it was a great learning experience. And this was all going fine until 2008, where I don't know if you remember, but the state of California actually went bankrupt. And so folks who thought that they had lifetime benefits unfortunately got the sad news that they no longer did. And that's a story for a different day. But essentially, all I'll say about that is understanding what made my practice, understanding the numbers, and what I needed to do, what I needed to tweak certainly helped in keeping me viable until I decided to sell my practice in 2015 to become the primary caretaker of my mother-in-law, who had moved here from Panama with a long list of health issues, uncontrolled diabetes, congestive heart failure, dementia, mobility issues, Alzheimer's. The list goes on, but I was lucky enough to be in a position where I could sell my practice, walk away. And I'm so sorry. Please excuse the fire. Anyway, hopefully you can still hear me okay. I live in a building where I can't shut that off. So we're gonna just push forward. So I was effectively retired for 3 years, did all the things that I thought retired folks do. Bought a motorcycle, played a lot of tennis, did some gardening. And after 3 years, I thought, you know, I think I still have a little bit that I think I can contribute. And so after a quick Google search, hadn't heard of AltaMed before, sent my application in, and within 3 months, I think I was onboarded and started my journey with AltaMed in November of 2018. A little bit about AltaMed. They were initially established as a free clinic in East LA in 1969. We're now a leading healthcare system that provides care to more than 300,000 Southern California residents in over 44 sites throughout LA and Orange County. We have medical, dental, senior care, urgent care, pharmacy, HIV services. No, I don't think it's an emergency. And again, I'm sorry, working remotely has its benefits, but certainly I don't have as much control of my environment as I'd like. But a little bit about why I chose AltaMed is because it, as a provider, having been in the field for as long as I have, and I was, again, fortunate enough to do the kind of dentistry that I wanted to do, their mission really aligned with mine and what kind of dentist I wanted to be. So, sorry about that. Their core values, or part of their core values, is the patient comes first. And really that was how I practiced in private practice. So there were a lot of similarities between AltaMed's mission that were in alignment with mine. They value their employees. They encourage process excellence and innovation for quality outcomes. And when I joined, that didn't hold as, that wasn't as important for me. I was happy to contribute what I could to my team, but it certainly leads a lot of what I do today. And some few facts about AltaMed. As I mentioned earlier, we have about 44 medical sites, 8 PACE sites, and that's our senior care locations. We have 10 dental clinics. We have 10 pharmacy sites. And these numbers are pulled from, and I'm sorry for the jumpy slides. These numbers are pulled from April of last year to March of 2000. So in that time frame, in that year, we were able to accommodate over 1 million visits. Dental alone came close to 116,000 visits, which is, when you look at these numbers, for me, it's like, oh my God, I'm so exhausted. We saw a lot of folks. We have over 3,200 employees, and for our providers, there's about 420 full-time providers, 394 contracted providers. Of those providers, we have 52 full-time dentists. The majority of our clinics, at least for our dental sites, we have 3 sites in Orange County and 7 in LA County. So the majority of the patients that we see happen to be in Los Angeles. My balancing act. So I'm fortunate enough that I work in 2 different worlds. That picture is as close to my cubicle as I could find online, but I spend 3 days of my week, Tuesday through Thursday, working with the clinical informatics team. One day I get to spend remotely, yay. And 2 days of clinic. So Fridays and Saturdays, I go to the dental clinic in Boyle Heights, which happens to be about 2 miles from where my previous private practice used to be, just a little fun fact. But when I accepted this position, I thought, okay, this is great. I can split up my work week. It'll give me a good balance. I could wear a different hat on different days, have a clean separation between the 2. And I'm sure those were very naive thoughts from someone who was inexperienced at the time. So I've learned that I can't really separate the 2, because once you learn what you learn, once you know what you know, you can't block that knowledge from what you do on a daily basis. So I chose this image of this wave motion machine because I thought that it represented how I feel on most days, where I oscillate back and forth between, okay, what am I working on today? I got an email this morning about something that may or may not be a problem with our dental treatment plans. And I immediately go to, okay, I'm in clinic tomorrow. How is this going to affect me? So I'm always going back and forth. There's really no separation. But if we look a little bit into what we do as a clinical informaticist for my organization, I am the dental representative, the dental informaticist of the team, but I am not alone. Luckily, I work with a great bunch of folks headed by our fearless leader, Dr. Eric Lee. He's our CMIO. We have a great associate director, Michael Eaton. My colleagues, Dr. Huang Chen, who is a family practice physician, and Dr. Jeff Arroyo, also a family practice physician, are fantastic at what they do. We have a pediatrician, Dr. Christina Jung, who works at CHLA and also for AltaMed. So there's a lot of things for me that come full circle. When I joined AltaMed, we're currently looking for a nurse CI to join our team, and also a clinical pharmacist. So hopefully our team will be full soon enough. But essentially, my team and I, translate workflows into epic terms and vice versa. We work with our leadership to prioritize our goals, work with our analysts, of course, to try to achieve those goals. We take data, we analyze it, leverage it, depending on our goals as well. There's reinforcement of training and workflows. We support our upgrades, which happen twice a year. As you know, for those anyway who work with Epic, they're constantly upgrading their EHR system, which I happen to love, which means that we're never going to fall behind. We're always going to push forward. But we need to then help our colleagues stay on top of what those changes are, and that takes a great amount of effort from the entire team. We end up being mediators between the clinical staff and the informatics staff. And of course, we troubleshoot with different folks. And this is just a short list of the things that you all do as well, which of course doesn't include all the ad hoc meetings, the phone calls you get from different managers and directors, texts, etc. Looking a little deeper into what my daily week looks like. I like to interact with my analysts on a daily basis just so I know that we are on the same page, that we are making progress in our different tickets. And I need them to know that I'm accessible to them for whatever they need in case they come across any issues. I meet with the CI team every week, one meeting with the analyst, one without, so that we can further discuss certain tickets. I meet with my work group, which includes the operational leadership as well as the clinical leadership, every other week. But I consistently meet with my dental leadership, just again, so that we can all stay aligned with what our organizational goals are and make sure that we stay in that alignment as we move forward. Meet with my EPIC CS bi-monthly, and then as a group, we push out EPIC updates to the organization, to the providers. I provide that in our monthly dental provider meeting. Sometimes we need to review workflows, and I kind of fly on the wall at our monthly dental directors meetings, and I like to participate just so that I can try to follow trends and see, kind of gauge where we're going, where their concerns are, if they're having any challenges. I want to anticipate what needs they may be having so that we can get that out to them as soon as possible. And again, 2 days of the week, I see patients, and that means that I have 19 scheduled patients per day, 18 if I have what's considered a long appointment, which is a root canal or a crown prep, which is where, again, what I used to call my relaxed days, because dentistry, after doing it for 23 years, turns out to be the easiest part of my day. What does that look like? Let's look at that clinic day for me. So we break up those 19 scheduled appointments. 7 of those are exams, and those could be kids or adults. So it could be super easy. And when I say kids, I mean anywhere from newborns to, again, teenagers. Patients, our patient base, of course, are the underserved. So I'm going to see a lot of adults who haven't been able to see a dentist in a long time. And that can often include a very long treatment plan. 2 patients are reserved just for emergencies or walk-ins, and oftentimes, as dentists know, that can turn into treatment depending on what the situation is. And there are 10 treatments that I'm required to do on a daily basis, which isn't bad. Again, I've been doing this for a while. 19 patients isn't a lot, but of course I have to keep in mind, we have dental quality measures that we try to meet. We have Press Ganey, which is our patient feedback. So not only do I need to provide good, consistent quality care, I need to deliver it in a way where the patient feels that, number one, I know what I'm doing. Number 2, they feel like they're heard, like their needs have been met. I deliver it in a way where it doesn't hurt, minimize the hurt anyway, so that they feel comfortable enough to recommend their friends and family to us, because really the goal is for them to come back. We want them to be an active participant in their care. Slides that I've chosen today, just so you know, are my top 3 favorite procedures that I like to do. They are extractions, they are root canals, and they are crown preps, in that order. Those are my fun procedures. That's what makes me smile internally. When I'm doing any one of these 3 things, I know that I am in the right field, because it just makes me smile. I like knowing that I have a certain skill set that can take people out of pain, and hopefully I can do that without causing them pain. So that's just a personal goal of mine. But while I'm providing this dental care that I've worked so hard to try to master, of course, I'm focused on what's in front of me, but I'm also thinking, is my assistant documenting this correctly? Did they get consent forms signed? Did they have the next visit up? Is the front office going to know what I want to do for their next visit? I'm looking at process. I'm looking at, do I have all the equipment I need? What can we improve? Could I have done that a little faster? What could I have done to give the patient a better experience? So I'm always going back and forth again, trying to balance what is it that I can do better at my other job so that I can do this job a little bit better, a little bit faster, so that the patient feels a little bit more cared for, and would, again, want to come back, not necessarily for themselves, but refer us so that we can become their provider, their place of provider of choice is what the goal is. That's me and my personal experience on a daily basis. But again, if I step back a little bit and look at it from a higher level view, I need to understand that my dental department is made up of more than just me. As I said before, we're made up of 10 sites. We also have an oral health unit, which means that we have a converted van that goes to different locations. I don't know if you remember from my previous slide, but we have 44 medical locations and only 10 dental sites. So 10 brick and mortar dental offices. Our oral health unit team is able to go to those sites. They also go to schools in different locations, and they're able to offer dental care. We have an RDHAP who's teamed up with a dentist, and they're able to take x-rays. They do the treatment planning. The hygienist is able to do the cleanings, do any deep cleanings, prophies, sealants, before he hands off the rest of the treatment to be completed by the dentist at the most convenient location. So they're going to have different requests, different needs to make sure that they can do the job they need to do in a remote setting, which luckily, again, I have a little bit of expertise in, since I used to do that early on in my career. In addition to that, we have a dental video visit team. So we have a team of dentists dedicated to provide dental video visits. A lot of times when folks call in for an emergency, those emergencies are routed to that team so that they can better triage the needs of that patient. Sometimes they just need a consult or a referral because they lost it. And so rather than coming in, we're able to take care of that for them over the video visit. And again, they're going to have different needs than someone like me who's stationed in one location at all times. We have a handful of pediatric dentists, so and they're scattered in different locations, but their notes are going to differ slightly than mine. They're going to need other things, again, more tailored to them. We also have dental students from different dental schools who rotate in at our Anaheim location to get real world experience. Now, they're going to need access to the EHR system, but we need to make sure that they're not writing prescriptions since they're not licensed to do so yet. So again, the modifications need to be met, and I need to be aware that although I am a practicing dentist, my colleagues are going to have slightly different needs than me. And so any request that comes in, I have to make sure I need to at least consider, you know, is this in alignment with our organizational and departmental needs and goals? Is this requested change going to improve the existing workflow somehow? Is it going to improve quality of care or how I deliver that care? All things that I'm, again, trying to balance out since I feel like I live in two worlds. But moving forward into a little bit into Epic and why I love it so much. I love having an integrated EHR system. I love being able to have at my fingertips that patient's health history. One of the things that slowed me down in private practice was having to wait for a medical clearance letter or just verifying certain things about their medical health before I proceeded on with certain treatment. So that's been a plus from day one. One of the things that AltaMed does that I think I've mentioned in a previous meeting is that they have come up with medical dental integration, which can mean a lot of things, but for AltaMed, it means that if you as a new mom, new dad, come in with your child to see your pediatrician, and you happen to be at a location that has a dental office, a dental site in that same facility, we have the opportunity to go into that visit while you're waiting for your pediatrician, or perhaps after you've seen your pediatrician, and do their very first initial dental screening, which is fantastic. When I learned that we did this, I got super excited. Number one, getting access to those kids before they have teeth, you can set the stage for the rest of their life. You know, cavities, I don't need to let you guys know, it's almost 99% preventable. It doesn't have to happen, but you need to know what you need to do in order to prevent that. So having that conversation early on with young parents, getting them ready for a lifetime of good oral health care, for me was a great opportunity to give them a really great first dental experience. So plus, who doesn't like seeing a newborn baby? So anyway, so anytime I get a chance or anytime I'm called to do an MDI, I'm super excited to see and talk to not only the newborns, but obviously the parents, and be a reference or a source that they can ask all their, you know, questions that they might not know. There was also a program, and this is pre-COVID, unfortunately, but we have a program called STOMP, which is a pediatric healthy weight program that the kids would come in. These are high-risk kids who are at risk of getting diabetes. So they would come in and they would teach them a little bit about nutrition, teach them a little bit about exercising, but really under the guise of playtime. And if I had a patient no-show and I had a moment, they would allow me to go in there and talk to the group and again, introduce how having good oral health care plays a part into your general health. So that was a great opportunity to have with the kids. Sorry, I just got a question of, can MDI be applied for all age categories? I'm sure you could work with your organization, yes. I know for us, our MDIs, I'm sorry, I'm answering the question that I got, if it could be applied to all age categories, but for AltaMed, and for me to go into the pediatric room, we have, we go by our guideline of 0 to 5 years. And again, I wasn't part of the committee that made that decision, but you can create any program you want. I think that for me, the point was just being able to add that value to that patient's appointment, invaluable. So again, I look for those opportunities where we can kind of, there's a lot of overlap between the medical and the dental field. And so it doesn't take much to just kind of step in and say, hey, you know, I have a question about this. And we're already taking their blood pressure every time they come in to make sure that they're at a range where it's safe to do the dental treatment that they're in for. If you create that relationship, I think, with those pediatricians, I sometimes still get phone calls. It's not necessarily an MDI, but some pediatricians will call out to the dental department if their patient has a dental question. And certainly if I have a moment, I'm going to walk down the hall and be available to that patient. And again, having any kind of set or informal relationship with the two departments, I think, is always a benefit for the patient. I mean, anytime they can get two professionals looking at them or their child, I mean, what a great day for that parent. One of the things that we're going to be working on soon, next month, we're going to be starting a pilot program where we, dentists, are going to be offering to take the hemoglobin test for folks who are found to be overdue. So Epic, again, has this capability where folks who are overdue for their certain care gaps, when you come in for a dental visit, if you are identified as being overdue for that test, we're going to be able to offer that test to the patient, do the little finger stick and let them know where they are. And it certainly encouraged them to see their PCP because, again, we're a team, and the goal is overall health for that patient. And I'm really excited about this. And again, it's another chance for me to step outside the box a little bit, offer something that normally isn't offered when you're coming in for dental treatment. But anytime I get to, again, add value to that patient, it's a good day, because at the end of the day, as healthcare providers, we certainly like to help people. I know that was, I think for all of us, had some form, in one form or another, it was part of the college essay that we wrote to get into college or med school or dental school. So we all like to help people, and in any way that I can do that, I certainly try to look for those opportunities on a daily basis. And my last slide here, I'll explain the picture in a moment, but clinical informatics, for me anyway, gives me a platform to affect real change, not only for myself, because again, I get to reap the benefits of the work that I do there as a provider, but it makes me a resource for my department to improve on the existing processes based on real data. So the hope is that these changes not only increase the quality of care for our patients, but I hope that it increases our provider satisfaction as well. And just having that mindset, trying to find that balance between the two, because everything in life I've found is finding a balance. This is Harper. He is my rescue. I got him when he was 7. And all the information I had on him was that his family was moving out of state and couldn't take him. He had just undergone surgery to remove a mass. He had a collapsed trachea. And other than that, he was healthy. But again, never had a rescue. Did my research, read up on it, and he came home with me. And again, through observation and his actions, because he can't tell me what's wrong or what he needs, I've been able to gather my data points. He didn't like certain food. He didn't know how to climb upstairs. He didn't like to be picked up. He bit folks when he was seemingly surprised. Found out that he's deaf, so he doesn't like to be picked up when he doesn't know it, because he doesn't know what's happening to him. He never used to like car rides. So when I saw this and I took this picture, it just reinforced the fact that I think if you take a little time to examine what's going on, in his case, it was, looking at his routine, looking at what his schedule looked like, what the activities were, making little tweaks here and there, seeing a result, not seeing a result. You can really do some good if the right decisions are made. And hopefully, again, when we look at our processes and we look at our data, we can tweak it enough to where we can hope for the best possible outcome. So I'm going to end with that in mind, and hopefully, I don't know if there's any questions. I thank you for your time, and thank you for having me, and I'm happy to take any questions you may have.
Thank you so much, Winnie. We really appreciate it. I really like that last slide too. That was a good analogy. Do we have any questions from the crowd? You can feel free to unmute. You can put your questions in the chat while people are possibly thinking. And I know we hear this question quite often now, but I'm interested to know how your workflow changed or what kind of changes you all made based on COVID. Were there any major upsets?
Yes, COVID, great time. That's about when this team came together. This team was assembled a few months after we went live with Epic. So we were on it for a few months. COVID hit. There was nothing really established. My department went out on furlough for a couple months. So we had a little time to kind of gather, not a whole lot of time. So I have to credit the CI team and the IT team really that hustled and got together some created COVID workflows. So we became one of the major testing centers in Los Angeles, and people, workflows, they didn't exist, so they had to be created. And again, the team worked after hours is an understatement. A lot of build was created that didn't exist before, just to, again, for drive-through testing sites that didn't exist but were created. The IT team had to figure out a way to give them the equipment that they needed to do these tests. So it was just like everybody else, I think, finding a way. There was obviously a need, and then finding a way to fulfill that need, and you just build as you go. And luckily it worked out for us, and we were able to transition through COVID by creating those workflows, because there was a team established, new team albeit, but the IT team was there already, and we were able to pivot during that time and introduce video visits. It started off as telephone calls, but create those workflows so that we could give our patients the access that they needed at the time.
Yes, thank you. Anyone else? I also heard you about. Sorry.
I have a question. How do you like utilizing the Epic Wisdom system?
How do I like utilizing it? I like you. It's great. A little background on that. The EDR system that I was accustomed to using, that I brought into my private practice, was Dentrix. So in terms of the graphics, it's not as advanced, but if I look at it solely as an EDR system, there's certainly room for improvement. But what it lacks in bells and whistles, I think that the fact that it's integrated to the EHR system, and again, I have access to their medical records, far outweighs anything that, or any hesitation that I may have had in the beginning. The ability to pull data, we're able to manipulate the system, create treatment plans, delete treatment plans, ease of use. I think it works really well. And like with anything else, I think that the longer you use it, the more agile you become, the more proficient you become, and the easier it is. And then you start wondering, what else can we do? So I'm at that stage where I'm trying to push the system a little bit to see how more user-friendly we can make it. It was a little cumbersome, especially with new builds, but what I like about Epic, again, is they're very receptive to any suggestions you may have. And so a lot of the suggestions that the users make actually at some point in time make it into production. So it doesn't fall on deaf ears. Are you currently using it in your organization?
No, I just retired from the Navy as the chief dental informatics officer. And of course, we're there going with the Cerner medical record and the Dentrix Enterprise, and the interoperability between the two is a difficult one, to say the least, on that. So that's why I was wondering how that works for you from the standpoint of being able to pull information out from the medical record, if it comes directly out of it, or do you have to open up my chart to get the information out, or is it
There's
kind
different
of
ways
seamless?
that you can pull the data. So there's different ways that you can pull the data, and the answer to your question is yes. So there's a tool called Slicer Dicer that any provider can go in and pull any data that they want to. There's special reporting groups that can help customize anything that you'd like to see. Again, Epic is very big on customization, so you're able to create what it is that you need. The interoperability, I know, is a challenge for most EHR, EDR systems. And again, I can't speak on it more positively, the fact that it is integrated and it actually does work, and I can go from one screen to another. I can look at someone's schedule in Orange County to see what they have. It's a fantastic system that works really well. The key thing is, again, you have to know how it works. And so having a team dedicated to just that, to making sure that we're using the system to its fullest capacity is great. So, and again, they have a great support staff in case any challenges you may face. They're a phone call, a Zoom call away.
Thank you.
Of course. Any other questions?
I just have one last one, if no one else has one. And I guess kind of about preventive care. You talked about it a little bit. And so how does that fit? How do you think that fits closely with what you do?
I'm so sorry, Carmen. Your audio is a little choppy. All I heard was preventative care, and how does that fit?
Yes, sorry about that. It could be this little fan. I have one. How does that fit with your daily task? I mean, are you all doing that on a daily basis? The preventative care, the education, things like that. Okay.
Yes. So again, I know that it's part of my repertoire and my colleagues at least. Anytime you're coming in, whether it's for an initial exam, whether it's an MDI exam, if you're coming in for treatment, you're going to get those questions from me, especially my teenagers, because I know they're listening. They may not participate, but I know they're listening. And so the question for me is always, even if I saw you last week, I'm going to follow up. Are you flossing now? Do you remember how you got this cavity? I don't think we can stress education enough. And so for me, the trick is always, how do I relate this particular cavity or you not brushing into something that's relevant for you? And so there was a time when I could fit in flossing into any conversation, into anything that you wanted to say. And for kids, for me, it was always, that has nothing to do with my life. It's not important to me. I see no benefit. I would find a way. And I think that part of our job as healthcare providers is making sure that we find that one bridge that will connect, why they're here, why they're suffering from this cavity, why they're suffering from periodontal disease, whatever that may be, into your life, so that you can see its importance. Because all we're trying to do is trying to get that patient we want them to participate. I mean, it's their life. And so for me, again, depending on my patient, and I try to tailor this specific to my patient, find out what motivates them and find out how, again, their periodontal disease, their cavity could affect them living their best life. But yes, education, prevention is key. And it's more than just, you know, you need to brush and floss, because that just goes in one ear and out the other. Everybody knows that. So.
Gotcha. Thank you so much again. We really appreciate your time and you coming to present to us. And we do have a what do you call this, virtual certificate of appreciation we'll send to you. So we really appreciate just showing us the insight of your professional life and even some of your personal life. I do want to just quickly, before we end, just let everybody know that we have some events coming up and some things that we're working on. We are currently working on a dental informatics curriculum development, which we have been talking to a lot of people. I see some of those people on today, and looking at what that looks like, including dental students, including private dentists, things like that. We also have a student open house discussion coming on Wednesday, August 17th. That'll be at 11 a.m. Central, and that's 12 p.m. Eastern. We also are working, and you brought this up a little bit earlier, reminded me, Winnie, about the status of dental informatics. So looking at kind of the past, present, and future report, like what are private dentists, what are government dentists, what are federally qualified health centers doing? So we're really excited to delve into that a little more. I do want to remind those or introduce to some of those that we have monthly membership meetings on the first Wednesday of each month at 12 p.m. Eastern. And then also our quarterly webinars, which you all are participating in one today. And we're still currently working with some schools, students, again, private practices, just trying to get the scope of what's going on in dental informatics and reaching out a little further to get them involved so that we have a wealth of knowledge available here for those who are in the field. And so thank you again. You will be receiving, and sorry, this is just an extension of what I just talked about, some of our outreach and what we're trying to do. You can also follow us on Twitter and Instagram. There are our things there. And then you also will receive a certificate of attendance. So thank you again. And thank you for attending, and let us know if you have any questions. Priya is on today. She has her contact information here if you'd like to reach out to her directly by email. And then Winnie, if you want to share your information, or we can definitely connect you if she does not feel like that at this time. So thank you for attending. You all have a wonderful day.
Thanks so much, Carmen.